Hello, everyone, and welcome back to the Genetic Genius Podcast. I'm your host, Dr. Lulu, and today I'm going to be talking all about autoimmune disease and the connection to the hormonal system. A really important topic. I'm going to be covering what is autoimmunity, how your body responds, what is the connection between autoimmune diseases and genetics. How can your body begin to become balanced again by using an autoimmune paleo-nutritional plan? So let's get started. Let's talk first about what is autoimmunity, right? What is an autoimmune disease? How is it functioning in the system? So an autoimmune disease really is all about the immune system. So a healthy immune system is designed to produce antibodies. These antibodies then attack foreign, right, or harmful cells that are coming into the body. And that can be a virus, a bacteria, all types of different things where the body has its natural immune response. It has that attack. However, when the body goes into an autoimmune disease state or an autoimmune disorder, the immune system then lends to produce antibodies that, rather than fight the infections, actually attack healthy cells and healthy tissue in the body, leading to long-term damage because those healthy cells are being damaged. And then an autoimmunity is really a state of immune confusion because the body is not sure why it's attacking itself. And that creates havoc in the immune system and results in the immune system really attacking the entire body. And we'll see a lot of systemic effects from that autoimmune disease. And the attack causes severe inflammation. That's one of the main things that I see a lot with autoimmune disease, is because the body is inflamed because the immune system is all about a natural inflammatory response. That's a innate response to the immune system. But when we have an autoimmune disease, this starts to get out of control. And then we'll see long-term effects of that inflammation and damage. And regardless of what type of autoimmune condition you have, because there's many, there's over 100. And regardless of that, the root cause is always the same: a dysregulated immune system. So that's really important to think about. So all of those autoimmune diseases are coming from that same effect, that same root cause. So we want to treat the root cause of the disorder instead of treating symptoms. Very important. So let's talk about another important factor: why we're seeing so many more women having immune disorders and why are women at a higher risk for developing autoimmune disease. I've seen in my practice over the past 15 years, I've seen this huge leap in women, especially younger women. We're seeing women in their 20s and 30s and 40s having autoimmune diseases. And this wasn't really heard of in the past, maybe in the past, I would say 20 to 30 years. So we're seeing definitely a shift. And so why is this? One of the main reasons that I always think about when it comes to autoimmune disorders is, why did the immune system get disrupted? And I always think about stress. Stress is one of our chronic factors when it comes to disease. The immune system gets disabled or has really too much on its plate, gets overloaded, and then doesn't function properly. So women in particular have a higher risk of developing an autoimmune disease than men. And so we want to be cautious, right? Or not cautious isn't the right word. We want to be proactive. We want to be preventative in knowing this information and really looking at those root causes. And stress, chronic stress particularly, is a big piece of that. And it's estimated that over 30 million women, that's huge, in the United States, I'm not talking about the worldwide here, in the United States, are living with an autoimmune condition. And the allopathic community, that typical MD world, the endocrinologists, etc., they don't have the tools to address the root cause of the conditions of an autoimmune disease because they're not taught. Those are not the pharmaceuticals that are developed. So that's another piece where we're seeing the autoimmune diseases really raging forward, is because the root cause of autoimmune diseases are not addressed. We're really not figuring out why they're happening and how to help the body to revive, to revitalize, to increase the vitality, to heal itself. And since the autoimmune disease is grossly misdiagnosed, we often see it misdiagnosed because the symptoms are large and they'll go into lots of similar baskets. The numbers are really much higher than we estimated, that 30 million. So it's a really big thing to be aware of in looking out for yourself. If you're listening to this and you're a female, also family members and your children, we want to be preventative. And that's a new place of health medicine, right? Of medicine, of health and vitality is the prevention. So I want to talk about the autoimmune diseases, which are most common. So you have these on your radar. So Hashimoto's thyroiditis, I see this in many of my patients because this is what I work with a lot, but it's also one of the most common that we'll see in autoimmune diseases. And that's when the thyroid basically is fighting itself. And then we'll see a whole array of Hashimoto's symptoms or thyroid symptoms throughout the body. Also, Graves' disease, this is another one of the thyroid diseases, including Hashimoto's. And this one is autoimmunity is the leading cause of all thyroid diseases. So we'll see Hashimoto's and Graves' disease. Those two are very high up on the marks. And in fact, autoimmunity is the leading cause of thyroid disease in general. So when we're thinking about thyroid disorders, we want to think, okay, what caused the thyroid to go into this? And we want to really work backwards, like back in time to figure out those steps. And that's why working with me is important, or another health practitioner like myself, that we're detectives, right? We're really going to dive deep and look in to see what's going on with the situation with the body. So type 1 diabetes is another really common one. Lupus, rheumatoid arthritis. I see this a lot in my practice as well, and multiple sclerosis or MS. So these are the ones that are the most common that we're seeing a much larger point in, or a much larger place in, with women in particular right now in society. So let's talk about some of the signs of autoimmune disease, because I really want you to be aware of these, because like I said, autoimmune diseases are commonly misdiagnosed. So when something is a disease that is commonly misdiagnosed, we want to keep those in our radar, in our mind, and talk about these with your practitioner if some of these start to come up, so you can address them right on. So achy muscles, and I'm not talking about when you go and exercise and you're having fatigue in your muscles after. I'm talking about achy muscles like all the time, like no matter what you're doing, you feel just like achy. And that's like that flu feeling when you're feeling, what that flu coming on, because it's the same place or the same point in time that your autoimmune disease or your immune cells are having that same reaction. Fatigue, this is a huge one. And of course, goes into a lot of other diseases. But when you want to look at these different things in combination. So fatigue, hair loss, very common with autoimmune disease, especially thyroid conditions, low-grade fever. Sometimes people aren't monitoring that. And if you're cycling, you can easily monitor that and check it in with your cycles. But also if you're having a lot of fatigue and hair loss, some of these other symptoms, it's good to keep a log, just write it down, check your temperature in the morning. Okay, what is my temperature doing? Am I having some low-grade continual or chronic fevers? This is really good to note. You can also notice that sometimes you'll be having a lot of sweating, not night sweats, but sweating a lot in the bed and waking up with the sheets really wet and soaked and cool. That is a sign of having some low-grade fever when you're sleeping. Numbness and tingling in the hands and feet. This is a huge one. And you want to make sure if that's starting to occur anywhere in your body, you're checking with your health practitioner right away. Skin rashes, very common autoimmune diseases like psoriasis, for example. And the skin is our first sign, right, that something is not going on right in the inside of our body, right? Anytime we're having a rash on the outside of our body, we want to think to ourselves, okay, what's going on in there? And talk to your health practitioner about that, particularly swelling and redness, trouble concentrating. So I see this a lot with autoimmune disease. It's like the immune system is going on overdrive and the brain is trying to send these messages over and over again. And we'll see a lot of brain fog, difficulty concentrating, and almost like mixed messages going out to the system. And there's way more that are connected with autoimmune disease, but these are the ones that I see most common in my practice that I wanted to bring up today, so that you can be thinking about them if you're thinking that you might have an autoimmune disease, or you already have one. So you want to talk about these things with your health practitioner And you really want to start getting to the root about why these things are happening. And if you think about those things that I was talking about, one of the things that I notice in similarity is circulation, right? We really want to get the body moving and circulating to get those immune cells that are causing havoc in the body to move out through the lymphatic system. So doing lymphatic movement is a really great way to really keep that system in check. So there's lots of things that we see in research that are related to autoimmune diseases and what causes them, right? So genetics is a piece. I'm going to be talking about these three topics particularly. Genetics is a piece, endogenous factors, and environmental. And then when I'm talking about environmental, I'm going to talk a little bit more about what I mean with that. But I always think about detox, right? And so if your body is in a state of especially immune response and inflammation, we always want to think of the word, the detox is a different kind of word, right? What I mean by that is a way to get the body moving and flowing, right? You could just think of flow, switch out all the thoughts and knowledge. And let's see what's a good way to describe that. Words that you've been taught that aren't correct with the way that your body moves. Think about flow instead, really getting their body moving and in flow and in movement. That's how your body releases things that it doesn't need anymore in relationship to toxicity. So let's talk about the genetic component. So for autoimmunity to express, right, to really express those genes, researchers believe that there must be like a genetic predisposition. Now, I'm on both sides of the fence here. I think your body has particular genes that are inside the body, but they don't just, that doesn't mean they're predisposed to having an autoimmune disease or predisposed to having, let's say, breast cancer. Those cells are in your body. It's what happens on the outside, that epigenetics, the things that turn on those genes. And if you're having a lot of expression of a particular gene, then you're having something in your epigenetics, whereas that's environmental factors, stress, food, nutrition, exercise that are turning on that gene that you don't want to be turned on. So we want to look in the inside with a genetic report, but then we want to look at the epigenetic factors that turn on your genes that are then going to aggravate that immune disease or going to then stimulate that autoimmune immune disease more proficiently in yourself. So we can have a huge influence on the way that our genetics play inside, or our genes play inside our body, by looking those environmental factors. So I think that's number one, hands down, the key when it comes to working with an autoimmune disease, getting a genetic report done and looking at your epigenetic factors that help your genes run the best, like optimally, right? That's how we can see how our body is going to behave in a preventative manner. And we know that we have these triggers, right? Triggers can be an internal factor such as stress, or an external factor such as stress, or hormonal imbalance, right? And that can also be from an external factor, but then that internal factor. And that's what I'm talking about when it comes to the hormonal imbalance. So when those genes, or when those hormones start to be chronically imbalanced, they start to have different messages, because hormones are messengers. They send different messages to different aspects of the body, especially the immune system. And that's why we then develop that autoimmune disease. And we can also have that environmental stress or environmental exposure, such as toxins in our environment. That's that getting into that flow state. We can also have viruses that affect us in our environment, our external environment and internal environment. So lots of different things come into play. Now, what is an endogenous factor? So endogenous factors are anything that is an internal cause, and an exogenous factor is anything in our external environment. So an example of an endogenous factor is like intestinal permeability, leaky gut, and that's when things are flowing through the gut into the bloodstream and causing havoc. And a big piece of that is endocrine changes. We'll see the thyroid highly affected from leaky gut, because those inflammatory factors are then running through the bloodstream, and the thyroid is really highly affected from leaky gut and other gut inflammatory issues. And these can occur throughout any part of our lifetime, especially as females during pregnancy, postpartum, menopause. The hormones shift, those messages start to shift. And that's when we're starting to see, I think now, especially, we're starting to see a lot more changes in women developing autoimmune diseases earlier, because we're seeing a lot of different hormonal changes in women in an earlier age because of those exogenous factors, those external factors factors, those quote unquote toxins in our environment that are changing our hormones. So environmental factors, right? These are everything around us, our external factors. So endocrine disrupting toxins, these are huge. Household, beauty care, food, anything around us that has a toxin in it, our body then has to absorb that toxin, right? Or it does absorb that toxin, and then it has to figure out how to process it, right? So it goes into its developmental phase of figuring out, okay, this goes here, this goes there. I'm going to have this quote unquote attack. I'm going to help this to easily flow throughout the body. But when we have this large amount of exogenous factors, these toxins coming in, these environmental or endocrine disrupting toxins, it's really challenging for the body because we're not having the correct flow back and forth to get things moving out. So we have to have more of a daily flow, a daily detox regime, a daily aspect to get things moving through the body, not just once a year, which is really harmful for your body in that state. So infections, virus, and bacteria, these are external environmental factors that can really wreak havoc. And especially if they go dormant in the body and then resurface, like for instance, Epstein-Barr virus. We'll see this a lot. This can really cause a lot of havoc in the system. Stress, prolonged stress, chronic stress. On our state, our society has been in a lot of stress, especially due to the pandemic. So we really, as we're moving out and through into this next phase of the world, we want to look at how did the stress impact us, right? And we want to be proactive, especially as women, be proactive in keeping that stress level low. And if it has affected you a lot, do a lot of self-care regime and stress reducing factors. You really have to bring this into your life and make it step number one every day so that you can meet each day in a reduced stress state to reduce that inflammatory response. Trauma, even childhood trauma, can cause a lot of external environmental stress on the body and certain medications. And I really believe that a lot of pharmaceuticals have a lot of stress on the system because they're not a whole body, a holistic approach to helping support the system, to help support the body. They're doing one thing specifically, and sometimes they can have a lot of then external side effects that cause a lot of stress on the body. So let's talk about number 3, the hormone autoimmune connection, right? This is the huge piece today. So there's really clear evidence now that I'm talking about how the body is responding, how the hormonal system is responding, how that messenger system is responding. And when we have that messenger response, especially when I mentioned about like chronic stress affecting the hormones, especially estrogen, we're going to see this change in the autoimmune system. So there's really a lot of evidence around the female sex hormones. And these are going to be estrogen, progesterone, and also testosterone, which is also, we hear a lot from that male perspective, but that's also one of our female hormones as well. And in an immune disturbance, these particular female sex hormones result in an autoimmune disease. That's what we're seeing. We're seeing these out of balance. So from my perspective as a naturopathic physician and functional medicine practitioner, I really want to look at the whole picture. And when I'm doing lab work, I want to look and see, okay, let's see if there's an autoimmune component. Yes, there is. Then I want to make sure I'm looking at the hormones too. I want to see how those hormones are playing in the system. Are they impacting? How are they affected? How can we help fine tune them to be more imbalanced? And as women, we know we go through at least 2 or more significant endocrine shifts during our lifetime. We have puberty, we have menopause, we have pregnancy. That's a huge endocrine shift. So these are important times when we want to make sure we're looking at the hormones and are they imbalanced? Not just doing a hormone panel when we feel out of balance. We want to be proactive and look at that ahead of time. When we have hormonal shifts happen, they exert really huge, significant effects on the immune system and can influence then the susceptibility of autoimmunity. So that's that important piece around hormones and autoimmune diseases. So let's talk about genetic susceptibility. Now, most women go through, like I mentioned, the hormone transition, right? We have many different phases. And if you have multiple children, you're going to have, again, many different shifts. And I think we're also seeing with the state of the society that we're living in now, the state of the planet with the chronic stress that we're experiencing, women are experiencing more hormonal shifts daily and throughout their cycle. So a small percentage of women will have a heightened risk of developing autoimmune disease. And this is, again, due to the genetic susceptibility. And That's due to your epigenetics. This is likely due to the genetic susceptibility and environmental influences. And in women, there are lots of interactions we experience between the hormones, the endocrine hormones specifically, and estrogens and androgens and immune response. So it's important to have not only a genetic report done, but have it analyzed by someone who is highly trained like myself or another genetic analyst to really help see how your body responds to environmental toxins, environmental factors, epigenetics, so that you can be in that prime state to help your body functioning optimally and 100%. And in spite of all of these specific autoimmune problems, and the aspect of the hormones playing a huge piece, autoimmunity is rarely discussed in a woman's health visit, right? In the women's health visits, we need to be talking about this so that women are aware. So that's why I wanted to bring this conversation to the table today. So you would hear about the importance, especially from that female perspective of women's health, where we need to be thinking about it, right? When we're going through our different phases. And as mothers too, when we look at our children and how they're developing, right? As the females and males start to go through their hormones, we want into puberty, want to look and see how their environment is and how they're behaving. So now I've talked about a lot of the factors. Let's talk about how the body can be helped and brought into balance by using the autoimmune paleo diet or the AIP diet or nutritional plan. I like to use the word nutritional plan instead of diet because I don't really like to use that word with patients. So an autoimmune protocol, this is one of the ones that's been most studied and that I use with patients that I find most helpful. One, it's really easy to use the autoimmune protocol, and I see the most results and the most success when using it with patients. And that's one of the reasons why I like to use it with autoimmune disease. It's reported to reduce inflammation, which is key, like I mentioned before, pain, and all the other symptoms and many other things by people experiencing autoimmune disorders because it heals their leaky gut. It heals the aspect of the gut that's really causing a lot of havoc. And when we talk about any autoimmune disease, we always want to look at the gut and the food. What are we eating that's affecting the system? And we want to remove potentially problematic ingredients from the nutritional plan. And that's what the autoimmune paleo does. So it has a couple of phases. The first is the elimination phase. This is going to be the first step, right? So first, we're going to remove anything that might be causing inflammation in the system. And these specific foods then trigger an autoimmune response. And that leads to systemic inflammation throughout the entire body. Bloating, nausea, inflammation, autoimmune symptoms like fatigue, brain fog, joint pain, all those ones that I mentioned before. So we want to reduce those inflammatory factors. And this phase is the elimination phase. So we're going to change some of our lifestyle factors as well, because remember, lifestyle factors are very important, that epigenetic component in the way that our body responds to expression of the autoimmune genes. So we want to make sure we're getting a lot of sunlight out on our skin. And this is really going to help improve our immune system, improve our vitamin D. We want to aim to get at least 7 to 9 hours of sleep per night, really restful sleep. And that's sleeping through the night and if you do wake up, you want to be able to go back to sleep easily, right? Having that long, deep sleep. Reducing stress, really bringing in a lot of self-care and bringing in things to reduce your chronic stress load. And this is going to help you get back to a baseline, or if you were inflamed before, get below that baseline, but I want to reduce that inflammation, want to get that inflammation down. So the elimination phase really involves temporarily removing grains, cane sugar, nuts, seeds, nightshades, eggs, and dairy. So that's a lot of different components, right? A lot of people go, oh my gosh, there's no way I can eliminate all those things, Dr. Lulu. But we're doing it for a short amount of time, but it also does depend on the autoimmune disease. A lot of times I'll have to have patients on an AIP nutritional plan for a lot longer. Let's say you've had an autoimmune disease for 10 years. It might take you longer. I'm not saying it does. I'm saying it might take you longer to have the response that we need. We were basically like rebooting your system that's been in this really deep state of chronic disease and chronic immune stress. So we want to reduce those inflammatory foods, and other things can also be processed sweeteners, alcohol, pseudo grains, coffee, and cocoa. These all can affect the immune system as well. And you want to check in with your healthcare practitioner like myself, an integrated health practitioner, naturopathic physician, functional medicine care provider that really knows about working with autoimmune diseases and knows how to reduce those inflammatory foods to give your body a time out, right? To increase the vitality, to really allow the healing. And if you're taking an anti-steroid medication, these are really damaging to the gut and cause extreme havoc. They just wreak hell in the inflammatory system. So that's an important piece to talk over with your health practitioner as well. So again, that first phase is going to be the elimination. And then we're going to be bringing in all these great foods. So that can be meat, veggies, herbs, fruits, animal fats, coconut, fermented foods like sauerkraut and water, kefir. It really markets these really healthy foods. And sleep cycle, we want to look at that healthy sleep cycle, reducing stress and anxiety, really looking at the epigenetic factors to help our body running at 100%. And this elimination step can really last anywhere from 1 to 3 months. And sometimes I've seen it for a whole year with patients. It really depends, but some patients will improve really quickly, even in 3 weeks. So then the next phase is the reintroduction phase. And this is a slow phase where we start to reintroduce foods. And this is going to allow our body to really see the things that cause inflammation. So let's say, for instance, you reintroduce dairy and you're like, oh my gosh, I can see this is not agreeing with the system. You'll bring that back out and then bring it in a later date. So you slowly start to bring in things to allow their body to start to create a new relationship with food and create a different inflammatory response, or basically not an inflammatory response, right? We want to have a healthy relationship with these foods. Bringing in also specific supplements and nutrients to help nourish the body, heal the gut, heal the autoimmune disease. And in both of these eliminations and reintroduction phases, you want to make sure you're eating organic, grass-fed and or wild caught meat and poultry and seafood for your protein, because you don't want to be adding in extra toxins to your healthy body that you're trying to heal. Really important. So also, let's talk about this last piece. So it's really not just one trigger when it comes to autoimmune disease. There's multiple facets, multiple triggers, right? It's not just one. And that's because it builds like an onion, right? We're seeing all these different layers start to build. And then you're like, you have these things, your body's talking to you and communicating. This is going on. Maybe you're having a little fatigue. Okay, now I'm having a little joint pain. Now I'm having this. These start to build because you don't address them. So you want to start to really increase the awareness of how your body communicates with you about what's going on. Most people don't have very good body awareness, and they tend to ignore the communications, which then causes a lot of downstream effects. So research really suggests hormonal fluctuation, immune polarization, and transition states together. This is what really drives the autoimmune tipping point, right? So we're seeing like all these factors come into play. This tips us over the edge and into that autoimmune state. So it's really important to know that we can reduce these autoimmune diseases. We can eliminate these autoimmune diseases, especially in women. When we look at our genetics, we look at the environmental factors, we look at those epigenetic factors, we're really starting to be proactive and preventative to reduce these autoimmune diseases. So autoimmune disease can totally be prevented in women. When we're proactive, we're preventative, we're looking at the ways that our body is responding with the hormonal aspect in mind, right? Our hormones are not just the reproductive hormones, even though like I mentioned, these are a big piece. We want to look at all the hormones in our system, the stress hormones, right? The reproductive hormones, the thyroid hormones. How is our body responding to the environment? What are we feeding it? Are we feeding it good things? Are we feeding it what it needs? Are we nurturing our bodies? These are the true things that are going to help with an autoimmune disease. So thanks again for tuning in today. And I hope you learned a lot about how the body interacts from the hormonal perspective and the autoimmune disease. If you need any help with any of the things I talked about today, please feel free to reach out to me on my website, or you can go to Instagram at Dr. Lulu Shimmick and send me a direct message. I have lots of information and great freebies are really about how to get yourself on track. So thanks again so much, and I'll see you next week.